Welcome to another interview in celebration of GUA's 40-year anniversary. Today I'm sitting here with Jason Robertson from Seattle. Jason has been teaching applied channel theory and therapy for many, many years. I think first time he was here together with Jonathan Chung in 2012 and has come almost every year since. Quite a few people have been following him, me included, and I think it has made a huge difference in my clinical skills for acupuncture. Jason, so glad to have you here. Thanks for answering the questions I've prepared. So the first question I have for you is, how did you get interested in Chinese medicine?
I first got interested in Chinese medicine when I was living in Taiwan, where I lived for 6 years, and I was studying Chinese language and actually working as a translator there for a British bank. And my original interest in Chinese language began with an interest in Taoism. So what kind of dawned on me, and maybe many of the students who are watching this might have a similar experience, is you come to Chinese medicine maybe through an interest in Taoism, maybe through an interest in other kind of East Asian medical kind of philosophical traditions. And what I realized, and this has been true more and more over the years, that essentially Chinese medicine is applied Taoism, the concepts of yin and yang, the concepts of like kind of being in the movements of nature. What I've found over the years is it's such a great way to like take the concepts of Taoism and then integrate them into your own life and also into the lives of patients. So it kind of just grew out of an interest in Chinese language and culture. And then while I was living in Taiwan, I had very bad allergies in the pollution of Taipei, especially back in the 1980s when I was there and early 1990s, and got some very good treatments for allergies, and that's kind of piqued my interest. And one thing led to another, so it kind of came originally from an interest in Chinese language. That's a long answer to your short question.
Okay, you got that interested and you had studied Chinese language. Where did you then study Chinese medicine eventually?
So when I was living in Taiwan, I actually looked into studying at the Chinese Medicine University, which is in Taichung in central Taiwan. And in the 90s, when I went there, they basically said, yeah, you can come and take classes here if you want, but you're not going to be able to get a degree. I think that changed in the years that followed, and I know people now can get degrees in Taiwan. And also, to be honest, I'd been living there for a while and I was interested in getting back to the United States. So I studied at the American College of Traditional Chinese Medicine in San Francisco. And in the mid 90s, when I went there, they actually had a program that you could do the whole program in Chinese language. So I did my first year and a half at ACTCM, as it's called, in Chinese, and then later switched over to the English language program at that school.
So you started actually in Chinese in America.
Yeah, at first. Eventually, that program didn't have enough students, so they had to kind of absorb the Chinese language program back into their English language program. But I started out that way, so that was kind of perfect. At least foundational concepts, I was able to kind of start in Chinese and then switch over to English with those as the years passed. But certainly, most of my training in San Francisco was in English, and that, then led to the same degree you have from the United States, a master's degree in East Asian medicine, which is what we use here as an entry-level degree in the U.S.
I think now you also teach at the Seattle Institute of East Asian Medicine.
Yeah, I teach. Yes, I teach here in Seattle at the Seattle Institute of East Asian Medicine. Starting, in fact, in 3 days, it will be. I was trying to figure this out. I think it's my 19th, but it might be my 20th year teaching first year point location. That's my very favorite course to teach. I do the first year students, take them through all of the channels and point location. And to be honest, the reason I love that the most is because it's by far the best way to review all of the points on the body every single year. So it's kind of a selfish reason. I love teaching that class. And so I've taught there and I've done some clinical training at that school, but mainly I'm an acupuncture points nerd. That's my favorite thing, location.
That's why you also like this class.
Yeah, I mean, I guess it depends. I mean, for me, one thing that my teacher, and maybe you're going to ask me about this in a minute, after I did my training at the American College of Traditional Chinese Medicine, I had a teacher there, her name was Dr. Wu, and Wu Yuewu was her name. And she came to us, maybe like when you're a student and many of the students watching this, you have a group of fellow students you like to study with. You get together in like a tea house or a coffee shop and work on reviewing material. And our little group was pretty close to Dr. Wu. And she's like, look, there's this guy. He's in Santa Cruz from Beijing. He's going to be teaching there for the next 3 months. You guys have to go down and take a course with this guy. So my study group and I, we went down. That's about, an hour from San Francisco where I was living, went down to Santa Cruz. And that's where I met Wang Juyi, who was in teaching actually at the Five Branches Institute, which was in Santa Cruz. And it was when I started studying with him that I started to realize the importance actually of point location, which I think over time has grown on me more and more and more, in the sense that one of the first things Dr. Wong said as I got to know him, which, I worked with him for almost 20 years, was that a lot of times experienced physicians, when they meet another physician, they ask, who did you study point location with? Like, that's a fundamental question that teachers or, practitioners often ask each other. And he just kept emphasizing, even in the last year I was with him, when I would go to Beijing to meet Dr. Wong, and, towards the end of his life, he would always, still be fine tuning, like make sure you can locate liver 5, show me where you locate stomach 36, fundamental points. The theory in East Asian medicine, many people who study East Asian medicine outside of China get really fascinated by the theories, the ideas, the amazing like concepts within East Asian medicine and nerd out on all of that. But if in acupuncture, if you don't locate the points correctly, and if you don't develop manual skills for locating points, then all these beautiful theories don't work as well. And so I'm realizing that more and more and more as I practice in these last couple of years, that the point location is really much more important than the obscure theory. So, what you were saying about point location and teaching that, I think a lot of it is the longer you practice, actually, the more you realize how important that is. So it's kind of fun to try to emphasize that to new students. And I think you guys at Chiwei, when I teach there, the students actually in Switzerland are very well prepared on point location compared to some places where I teach.
And especially also your concept of, you call it empty space, that I find super important, to find the correct point, to find that empty space in the vicinity of the point.
Yeah, or as I tell first year students, when you're needling, even if you find a nodule or something, a tightness or something within the channel at the location of the point, then, don't needle the thing, needle the space next to the thing. And that was fundamental for Dr. Wong too. It was like, this concept that the real action in acupuncture is in the fluid systems, which are in the empty spaces next to all the things we can feel in the channels. That's where the that's where the life is, instead of the kind of like less alive spaces where we find nodules and things like that.
And that's quite different from many other theories where they say find the nodule and hit the nodule, or needle the nodule, so that definitely is a game changer, I think.
It is, and but what I'm also influenced by other people I've interacted with in all the years besides Dr. Wong, and worked with Japanese acupuncturists over time, and watched some very effective trigger point needling approaches. Is that this is another big thing that I like to tell new students of acupuncture, is that if we look at the history of East Asian medicine, and Volker Schied, who I know is another teacher there at Chiwei, has mentioned this as well, what we see is that throughout history, there are all these currents of thinking, the Xue Pai in Chinese, schools of thinking. And so even within acupuncture, I think it's important for all of us not to get too hung up on saying this person has the best way, this person knows what they're doing, this is the truth from the classics, and these other people don't know what they're saying. The real, and I think this is true of a lot of the way you have diversity of teachers at that school. A great practitioner then is exposed to many different currents of thinking, different ways of thinking about needling even, and then has to kind of change depending on what the patient needs in that day. That can be true in herbal medicine or acupuncture. And so really good schools of East Asian medicine actually strive to kind of promote diversity of ideas. That's what we do at the Seattle Institute of East Asian Medicine. Instead of having like a guru at the top and everything is the same, it's this idea of diversity of thinking, I think is historically accurate in East Asian medicine too. So, I applaud that. That's the emphasis at Chiwei as well.
Thank you. Um, the development of Chinese medicine in the US. Now we have, for example, the doctorate degree. In Switzerland, we have this recognition of the profession. How do you see the development of Chinese medicine overall going forward?
Well, I mean, and you have exposure to this as well, Simon. I mean, I feel like it really varies from country to country. The way that Chinese medicine develops in each country, of course, is reflective of the culture where it finds itself when it lands. So the way East Asian medicine is practiced in the United States is different than it is in Germany, and even different than it is in Switzerland and certainly Italy and France. But the overall trend, I think, that I've noticed in 20 years of teaching around the world is that our medicine is growing. That interest in what we're doing is by far stronger than it was, and also there's a sophistication in our medicine finally coming to play. I think you and I were talking about this last time when I was in Switzerland. It's like we really have people now who have 25 years of clinical experience, legitimate clinical experience outside of China, and over time, we have access to more and more material from the Chinese language, great translations, of course, software that can translate material. So the sophistication of East Asian medicine has grown quite a bit. I really think, especially in the last decade. So it's kind of a corresponding interest in the public and a sophistication in practice, which of course leads to better results. So I think the future is bright. The danger I see sometimes in the United States, and I think this has happened in lots of places in Europe as well, is that, and this happened in China in the 1970s and 80s, is an overemphasis on training in, what we need, of course, biomedical training, Western medicine training, but there can be a tendency to kind of underemphasize the classical theories of East Asian medicine, which really represent a legitimate way of seeing the body, seeing physiology, seeing disease. And like, Jonathan Chang, my colleague who went to school in Beijing and did the TCM training in Beijing, he commented that a large proportion of what they had to learn was not Chinese medicine. And I think as we all strive to kind of integrate into medical systems around the world, there's a lot of pressure to kind of weave into mainstream medicine schools, and we have to be careful not to water down our medicine, because I think if we're not careful, we'll end up being technicians who are doing point protocols or formulas that match diseases instead of proper diagnosis and treatment. So that is a trend I think we all have to kind of keep an eye on, especially you, I guess, as an educator. I'm sure you're aware of this pressure as well.
If you would have to give a new student of Chinese medicine some kind of simple advice, like a short piece of key advice, what would you tell a new student?
I guess two things instead of one. All right. The first is whichever teacher you're with, get into their head. Instead of just watching what they do, try to ask why they do that. Like try to get into the model that they're using to perceive disease and treatment. So kind of make your teachers explain to you why they're doing what they're doing. I think that a lot of students are kind of overwhelmed and maybe even intimidated, of course, because they don't even know what's going on. But be a little persistent with your teachers and make them tell you why they're doing what they're doing. And I would advise you to beware of protocols too, because you'll notice a given teacher will do different things with a similar complaint. So try to get into their heads about that. So that's the first advice. And because we get busy as teachers and sometimes we forget to explain things that we think are obvious. So question. That's the first thing. The second is palpate. Whichever style of palpation your teachers are using, really make them show you how they do it. Maybe they're experts at the pulse. Maybe they are very, very good at observing the body, or whatever type of manual technique, Tuina technique. So use this time you have as a student to get better at palpating the body, because as you know very well, Simon, we don't depend on MRIs or X-rays or blood tests for our diagnosis. Our diagnostic skills are in our own minds and in our own hands. So really use your time as a student to learn about palpatory skills. I think that's the second advice.
Okay, thank you so much, Jason.
Yeah, thanks so much. And one last thing to say, we've talked a lot over the years, and Simon, it's just an honor to be one of the horses in the stable of teachers there at Chiwei. It's a wonderful institution, and I hope it continues for another 50 years. So thanks for all your support of the field as well over these years.
Thank you, Jason.